This is my student support system. Keep watching, keep learning. Assessment of pain. How we will assess? Assessment is an essential step in pain management. Following parameters may be used for pain assessment. This is pain location, intensity, timing of the pain, quality of the pain, and aggravating and alleviating factors. First we will see location. First parameter is location of the pain. In this assessment, a form may be used which include drawing of human figure or human body on which the patient is asked to shade the area where pain is involved, where the pain is felt. This is especially helpful if the pain radiates. This data may help in making diagnosis or cause of the pain. Intensity. Pain intensity is very subjective. The reported intensity is influenced by the person's pain threshold, the smallest stimulus for which a person reports pain, and pain tolerance. The pain intensity may have a range of no pain, moderate pain, or excruciating pain. Timing. Under this parameter, the nurse inquires about the onset, duration, relationship between time and intensity, such as at what time the pain is worst, and changes in the rhythmic pattern. Quality. Under this parameter, the nurse asks the patient to describe what the pain feels like. The nurse must record all the words in the answer that said by the patient. If the patient cannot describe the quality of pain, then the nurse can suggest the words like burning, aching, throbbing, or stabbing. Aggravating or alleviating factors. Under this parameter, the nurse asks the patient about what make the pain worse and what make it better, and asks specific about the relationship between activity and pain. This helps to detect factors associated with the pain. Now we will come to pain management. Pain management is the process of relieving pain and increasing comfort. It is an essential part of patient care. Pain management requires two types of strategy: pharmacological management and non-pharmacological management. Pharmacological management, there are a lot of pain medications which are prescribed by the treating health professional or doctor to relieve pain. These medications are to be administered as per prescribed route, dose, and schedule only. Non-pharmacological management. Non-pharmacological management of pain include massage, thermal techniques such as hot and cold applications, transcutaneous electrical nerve stimulation, distraction, hypnosis, music therapy, relaxation techniques, etc. These therapies are to be used under guidance of physiotherapist only. My student support system. Keep watching, keep learning.